Good morning. I was so concerned there would be only 3 people here this morning, so this is a bit overwhelming, but I'm thrilled. As she mentioned, I am a media consultant and freelance contributor to National Geographic and other platforms, but the only thing you need to really know about me this morning is that I am the 9th of 10 children born to a woman who was a maid and a father who was a mill worker in Cairo, Illinois. How many people have heard of Cairo? Okay, all right, that's about right. And you should also know that I did not go to a doctor or a dentist until I was well into my teens. So I think that gives me a little standing to talk about this issue of a living wage buying health. So that's the theme for this panel. And those of you who are interested in issues of socioeconomic equity and health equity are going to be hearing from some of the finest minds in the country on this topic right now. And I think they're going to be addressing a very central question, which I sort of characterize as, who deserves to be healthy in America? And when will we understand sort of the common sense value of ensuring that as many people as possible are able to afford to be healthy? So to help us explore this question, I'm pleased to introduce this panel. Gotten to get to know them over the past few weeks over email, and so it's a privilege to finally put names to faces. So we're going to start with my immediate left, Crystal C. Hall. Crystal is a social psychologist, and she's an associate professor of public policy at the University of Washington in Seattle. Her research focuses on the intersection of psychology and public policy, with a focus on policy design and implementation. She has provided guidance and training to community organizations, nonprofits, and government agencies that are seeking to implement tools from psychology and behavioral economics into the design and delivery of their programs and services. Next to Crystal is Carrie Liana. She is the George H. Love Professor of Organization and Management at the University of Pittsburgh, where she holds appointments in the School of Business, the School of Medicine, and the School of Public Policy. And I think you need to find something to do with your time, because her field is organization science, and which she applies in settings like healthcare and public schools in America. And she's currently working on a book titled Financial Precarity in America. And so we're going to be talking with her about this very intriguing term. And next to Carrie is Tobias Reed. Tobias Reed was elected Oregon State Treasurer in 2016 after a decade of serving in the Oregon House of Representatives. While serving as a state rep, he sponsored the legislation that created the state-based retirement savings program for people who didn't have that option at work. And it's called Oregon Saves. I'm sure many of you have heard of Oregon Saves. And it's actually the first state-based program in the country that allows people to save when their employers don't provide that for them. And it's collectively saved over $22 million. So that's pretty impressive. But I thought I'd start with another way of introducing you and allowing the audience to know who you are. So I thought I'd like to ask each of you to take a couple of minutes to tell me what the statement, "a living wage buys health," means to you. So Crystal, why don't we start with you?
Sure, thank you. Good morning, everybody. Wow, thanks. We're
Awesome.
interactive
Audience.
already. Wow. Exactly, you're all awake. It's a huge privilege to be here, and I just want to say thanks for making space to talk about this topic. I am a social psychologist. I study decision making. I think about decision making in the context of poverty and how we can use insights from psychology to understand how to design and implement public policies. And I think if to be as brief as I possibly can, to me, thinking about the idea of a living wage buying health, to me, it's really about a living wage buying people time and space and the resources they need to take care of all of their other needs. Because if they don't have a living wage, if they don't have money to get some of those other things, it's going to be impossible for them to do that. And as a psychologist, I think a lot about how different types of resources influence the way that people make decisions. And so sometimes we are talking about money directly. Sometimes we're talking about the time that people need to engage in the ways that create healthy patterns of behavior. And sometimes we're talking about other things like what is the impact of stigma on decision making, and how does the stigma of race or poverty have an impact on that? And so to me, when I think about what a living wage buys people, I think it really buys them the time and the space they need to engage in ways that create long-term economic, physical, and mental health.
Great. Carrie.
Great. Thank you, and thanks for inviting me. I'm very delighted to be here. When I think about this idea of a living wage buying health, what I think about is how stressful it is to be worried about paying the bills. And we know a lot from decades of research about how chronic stress is detrimental to health. We know it's detrimental to physical health, from everything from sleep disruptions to enhanced cortisol production. We know it's detrimental to mental health, that what you see is increases in anxiety and depression, negative mood states like fear and shame and anger. And by the way, the second leading cause of suicide attempts are money problems. And we also know that it's detrimental to social health in terms of people tend to socially isolate when they're having money problems. The second thing I just want to say is that health and financial precarity go hand in hand. That what we know, again, from decades of research is that when you're financially precarious, you tend to be less healthy. But the opposite causal relationship can also be the case. We know that when people get sick, it often drives them to financial precarity because they can't pay their medical bills, because they have time off of work, et cetera. And we know that health problems are the leading cause of personal bankruptcy filings. The punchline here, I guess, is that the financially precarious are less happy, less healthy, and they die younger than the rest of us. And there's a whole host of reasons for that. Part of that is because of chronic stress. Other parts is because they can't pay for medical care, et cetera. Final point I just want to make is when you think about our aspirations in the United States, they're rather modest in terms of, for example, raising the minimum wage. The minimum wage, as you probably all know, hasn't been raised in 10 years. What people are really crossing their fingers for is a $15 an hour minimum wage, which, by the way, would double the current minimum wage. But even at that, if you work 40 hours a week, full-time, $15 an hour is $30,000 a year. That puts you below the poverty line in many urban areas.
Tobias.
Tough acts to follow. I'm really grateful to be here as well, and I think perhaps my role is to be the counterpart to the academics here and try to back up what they've both been saying. And I think that's perhaps the value I can provide. I really agree with what both of you said around what health means, and I think the twist I would put on it is in addition to individual health, it has a big impact on community health. So I'm the state treasurer, and usually people start talking about numbers with me, and of course I am kind of a numbers guy. That's required to be a state treasurer, but I'm also a numbers guy who cares about families and individuals and what the economic future of the state is. So I think we have a role in the public sphere to acknowledge the complexities that people encounter in their lives and try to craft policies that acknowledge that and as you both said in your own way, make space for people to have the same kind of access. And I'm sure we'll get into the details of Oregon Saves, but that's really what our idea is built on, removing barriers and complexities and trying to make these questions less intimidating, because we've all got a stake in that, both from a financial point of view, when there are avoided costs, when people have their own resources, they are less of a demand on a state budget that is already stressed. And equally important, there's all kinds of untapped talent and potential out there that we need to take on the challenges we already have.
Tobias, I'm so glad you used the word complexities, because when I was a journalist covering welfare reform in 1994, 5, and 6, those very critical years of policy development in DC, I would wander the halls of Congress and hear poor people being described as little better than leeches, or one legislator literally used the term alligators snapping up our resources. And that certainly didn't describe my parents, who worked very hard. It didn't describe anybody I knew. And so it really created some dissonance for me as a journalist bearing witness to these issues and trying to communicate what was happening, and just really feeling awful, to put it that bluntly. So for your research, I think that's why it resonated so much to me, because you have been able to sort of get at this issue of how policy and the way people are treated, the stigma, how that truly affects their entire life. So I wanted you to bring in some of, first of all, your own personal experience, how you shifted from physics, I think, to psychology, because you didn't see representation, and then talk more about your research.
Sure. Yeah. So I did start out studying physics when I went to college, which was very exciting. I still love physics, and there was a representation issue. I was one of, I think, 2 women in a class of 40 incoming students that were studying physics, and for a variety of reasons, I'm sure many of them I don't need to state, I moved away from that area and I started just exploring other avenues that I could study, and I got really interested in psychology, and I was taking some classes in public policy, and it was really lucky timing, because it was a space where the field of psychology was beginning to have a small voice in the world of public policy. And what I really liked about psychology that I could bring from physics was that social psychology is truly a science, and we create theories and we test theories and we try to understand behavior. And I think psychology is really unique because most of us don't really have lay theories of physics and chemistry necessarily, right? But we all have these lay theories of why people behave the way that they behave, right? And so when you look at the intersection of our theories of how people behave and you link it to policy questions, you get to places that can be really interesting and can also be really dangerous. And so when we look at decision making in the context of policy, of poverty in particular, these questions that are often very policy relevant bring in these assumptions that we have about why people lack resources, what behaviors they may have engaged in contribute to their financial situations. And in my field, we try to think about what is it about the context of living in poverty that has an impact on decision making. So rather than thinking that people are living in poverty because of something that they did wrong, we think about what are the conditions that created the poverty, and when someone is living under conditions of poverty, how does that influence how they behave? And from a broader level, my field looks at what are some of the heuristics and the biases that we see in behavior that we all engage in, because we all make decisions that often look relatively irrational. And so in the context of questions related to poverty, I think it's really important for us to understand what are the contextual factors that influence behavior, and how can we try to alleviate some of the negative conditions that lead people to making behaviors that are less than ideal for their long-term success. And so when we do that, I think it allows us to see people as a little bit more human, and it helps us think about strategies that are a little bit broader and that think beyond giving people individual accountability and trying to hold them accountability for their own poverty. And so one way that I've looked at that is thinking about the stigma of poverty and how the stigma of poverty influences behaviors, and looking at strategies to try to alleviate some of that stigma.
You know, I want to drill deeper with you on the issue of assumptions and how they play into public policy. But I thought this would be a good point to go to Carrie, because when we did our calls prior to this, you used a term called the democratization of poverty, and how now when we think about who's struggling to put food on the table, who's struggling to send the kids to school or do whatever, generally speaking, historically, it's always been poor people. They're just out there hustling. but you start your paper, which I would encourage all of you to read, by the way. It's in the Stanford Social Innovation Review, the spring 2019 issue, and it's about financial precarity that she's going to tell us about. But you start with a man who's making $60,000 a year, which sounds like a lot or enough, and how the stressors on him are affecting his health. So talk a little bit more about how now this rubric of who's poor and how they act is starting to widen out.
So financial precarity is this persistent worry about money, persistent worry about paying the bills. And as you said, Rachel, that we really see this being democratized, that financial precarity was always a condition of the poor. And now what you see is it's a condition of the middle class and even the upper middle class. And if you think about that and what is the evidence of that, one anecdotal piece of evidence is everybody remember the government shutdown of a few months back? And the news, all over the news, where people went without a paycheck for 35 days and they were strapped. They were living paycheck to paycheck. And in this country, if we look at the national surveys, about 3/4 of us say we're living paycheck to paycheck, and over 80% of women, by the way. 1 in 10 people making over $100,000 a year are living paycheck to paycheck. 3/4 of us are in debt. Half of us think we will be in debt our entire lives. And many of us put off necessities like health care, and again, it's about 1 in 5 of us don't go to the doctors when we think we should because we're worried about paying for it. So this idea that financial precarity is only applicable to a small segment of the population is in fact not the case. And there's a whole host of reasons behind that that would take us another hour and a half to even begin to talk about. But nonetheless, it has been democratized. We think about, when we use the term democratize, it's usually kind of positive, right? But in this case, I think it's pretty negative. I went to a panel yesterday morning, and one of the executives at Prudential was there, and they were talking about all the work they do in Newark. One of the things they're doing is supporting affordable housing for teachers in Newark. Now, teaching was a middle-class job, that you didn't need kind of subsidized housing if you were a teacher. But again, it's no longer the case.
Tobias, I'm always happy to meet a policymaker who is human. I'm sorry. No offense.
Thank you.
If there are any other. But I say that because innovation and sort of empathy and understanding, the bits and pieces that go into the complexity of life is very important. And so while obviously we want to know more about Oregon Saves and how the legislation was developed, I'm kind of curious as to whether there are any markers from your life that may have led you towards this kind of policy development. And if not, that's cool too. But
I guess maybe this is the other point where I'm a contrast. So I was really lucky and really privileged in the generally kind of upper middle class upbringing I had, and my first job after college was at the university where I worked, and one of the first conversations was about the retirement plan they had, and the notion that, hey, if you contribute, I think it was like 3%, they'll match it with 9%. And
wow.
that was fairly powerful. Like, let me get started on that. And so this power of kind of suggestion, and Oregon Saves is built on the work of Richard Thaler and Cass Sunstein, and I'm sure everyone in here knows. But I always like the way they describe themselves as libertarian paternalists. That we want you to be able to choose, but we want to make it easier for you to choose what's in your own best interest. And that's really what we're trying to build. So I guess I can point back to that, to one of those early experiences of someone saying, here are your choices, but this would be a really good idea. And I think that's true for everybody. It shouldn't just be a person who's lucky enough to go to college and have a job where that is available. We want that to be true for everybody who's around.
I'm also curious about how much data you had at hand when the early conversations about this, because so often there is that need to sort of
Yeah.
quantify. Why should we be helping people?
We did have data as to the problem, but it's a really interesting story because we knew that about half of people who were working in Oregon, a relatively small state, but about half, so 1 million people in Oregon were working and didn't have any way to save at work. We also know that when people have that option, that choice, about 70% of people participate at some level. But if they have to go out and find their own IRA, 3.5% of people do that. So it's a pretty big difference. What we didn't have was any models for anybody else who's done this. So we're still the first, but we're not the only one now, and it's a great story to collaborate with our friends in California and Illinois and a host of other states who are somewhere in that process. But it's kind of scary to be the first one out of the gate. And everybody's like, you didn't meet your projections. Like, well, we didn't really have projections. We had scenarios because there's no data. There's simply no single source to say how many employers offer a retirement plan to their employees. It doesn't exist. So we're making it up as we go. The good news is we're on a really good path. And I'm going on for a moment here, but as much as we could get lost in numbers, what I really try to go back to is the people who have had this experience and what it means to them. And there's a guy in Southern Oregon, works at a ski area, so that's kind of appropriate to talk about here, whose face just lights up when he talks about it. He says, I didn't know where to start. I always felt intimidated. What am I going to do? But he says, now every time I look at the statement, I smile. I see it piling up, and I feel like I've got a future. And that, I would suggest, is something we all should want for our fellow citizens.
Crystal, I want to bring us back to that issue of assumptions because, again, I think it's so easy as human beings to look at a person and decide we think we know what they're about based on their income, the way they dress, skin color, whatever. But so I guess I had a thought in a panel yesterday about housing, and I think I have this radical idea that until more policymakers have that lived experience and understand truly what it means to have this level of stress and complexity in our lives, that we could, maybe not working at cross purposes, but we will not be able to make the impact that we could. So I wanted to ask you whether I'm on the right track in thinking that way based on your research, or what do you think?
Yeah, I think that's right. I think that very often there is just so much distance between the people that are not only deciding what the right policy or program lever is to deal with certain problems, but also how to implement those things. And so in my work, I think a lot about how do we often bridge this gap between some policy and some outcome, because I think very often it's this idea that, kind of if we build it, like everybody will come and get whatever it is that they need, but we know that that's not the case, not only for people living in poverty, but for everyone. And so I think that the question of what assumptions are being made when these types of tools are being designed is really important. And I think something else that I heard both explicitly and implicitly in multiple sessions yesterday, I think is in line with what you said about we need to have proximity to the problems that we're attempting to solve. And I think that is something that's very psychological. We can talk about people that have lived in certain experiences, and really we're talking about we need people that have the least amount of psychological distance between the true experience of these problems to help us think about what the solutions ought to be. And I want to particularly make a point about implementation, because just because we have a housing subsidy or we have a food subsidy, the way that people get to those things really matters. And how complex is the process? Where do people have to go? That piece of the puzzle is really important, and I think it can be really easy to gloss over that. And so in my work, I spend a lot of time thinking about what is that space between the program being there and people actually getting to it. And so I think that's also a really important question that we all need to keep in mind.
Carrie, this issue of trying to quantify impact of income on the quality of healthcare. Again, I'm always intrigued by attempts to measure that and really push policy or get people to come on board in that regard. So I want you to talk a bit more about, particularly, I loved you bringing up the government shutdown and the impact that that had on people's lives. And I know people, I'm in Charlotte, North Carolina now, and so I got to hear from friends and family of people who were affected, and it was really eye-opening. I mean, people who you thought were going along just fine, and they didn't have gas to put in their car. So if you're a researcher trying to impress a policymaker or talk with someone, an official about that, what are some of the other tools that you use to try to get that point across?
Well, we've done a lot of studies recently on basically how the disadvantaged become further disadvantaged. And let me give you an example of some of these studies. One of the things we're very interested in is how financial precarity undermines work performance. And what we see there, we've done several studies there, but let me just give you and I think this relates to a little bit to what Crystal was talking about, that basically when you're worried about money all the time, when you're chronically stressed about money, we all have a limited cognitive bandwidth. If this much of your bandwidth is taken up with how are you going to pay the bills, what are you going to do about childcare, et cetera, you simply don't have as much left over to focus on your job, to focus on other things in your life. So there have been some studies with social psychologists that have looked at the effect of worry about money on cognitive test scores. What we do is really look at that in the real world on job performance. So we did a study, for example, with a big transportation company with truck drivers. And what we found, and these, by the way, are middle-class jobs, that these guys, are almost all guys, make $50,000 to $70,000 a year. Chronic financial precarity. They're worried all the time about money. And what we find is the ones that are worried about money are far more likely to have preventable accidents. And that's after accounting for everything like general conscientiousness and other things, their health, other things that might affect their life. So there's a pretty good relationship there. We replicate that in experimental studies to make sure that we have the cause and effect right on that in fact this worry about money is really causing inattentiveness. We did a series of studies in nursing homes, and these are people that would really benefit from a raise in the minimum wage, nursing aides, that they tend to be lower wage workers. And what we found with them is that empathy is a really important part of their job, and empathy really predicts how attentive they are to safety issues like noticing bed sores, pressure ulcers, falls, et cetera. And that relationship is robust. If you're more empathetic, you notice those things more in your patients, except for the financially precarious, except for those people, and then it goes away. We find the same thing with college students, that SAT scores are a good predictor of first-year grade point average, pretty robust relationship, except for kids that are worried about paying for college. And again, when so much of your cognitive bandwidth is taken up with that kind of worry, you can't perform as well. So those are the kinds of studies where we really kind of try to make this case. It's not just something that we do for individuals, we as a society or as employers are doing to be nice or generous or kind, but really it's in all of our self-interest for people to be able to perform up to their potential. And they're walking around with this invisible backpack that the rest of us simply don't carry.
Before we move on, I really want to salute this work because I think it's adding to the discussion that we have as investors. One of the responsibilities we have in the Treasury is investing the state's portfolio. And in Oregon's case, it's about $100 billion. And we're invested in public companies. So having your research and what I'm sure you're going to do in the future is going to give us the platform and the credibility to say to the places we invest, you need to care about this, not only because it's the right thing to do, which it is, but because that's an impact on our investments and our ability to meet our obligations to our beneficiaries. So thank you.
I want to make sure we have some time for questions, but I'm going to take this moment of a moderator's privilege to throw out a little socioeconomic Molotov cocktail here. I was at...
Wow. Can't wait.
Wait for it.
Yeah.
Over there.
The back door.
I was at a town hall discussion in Charlotte, and I have to say, after 8 years of living in Eastern East Africa, lived in Nairobi for 8 years throughout the entire Obama administration, and came home in time for Trump. So,
Welcome
tell you
home.
about my timing. But I got to Charlotte about a month before the Keith Scott shooting, police shooting, and then a month later, Trump was elected, and then a month later, there was a Klan rally about 50 miles from Charlotte. So, if there are any international organizations here, I'm looking for work. But I invoked this to say that someone stood up in a town hall meeting talking about the issue of Charlotte being listed as one of the bottom cities in the country for social
Mobility.
mobility, exactly. And the man stood up and said, what you need to understand is that the system is not broken. The system is working exactly as it was designed to work. And it's working beautifully for the people who have the haves. So what I want each of you to do, and I'll start with you to give you a
Great.
nice little, put you on the spot. What does that statement mean? I mean, and I fully believe it. I guess maybe it's because I'm an African-American woman born in poverty. But in terms of the system, I mean, what work are we going to have to do to try to address the systemic aspect of this problem?
Wow. Well, I'll set a low bar so my co-panelists here can easily exceed it. I think everything is the answer, and I go back to a statement that I've heard used in the context of climate change when someone says, "Do you have enough time?" And the answer is, you have exactly enough time, starting now. I think every one of us probably is going to have a different answer to that based on the experiences we've had and the place where we stand and sit now and what tools are in front of us. My role as state treasurer is really exciting to me because I get to make arguments for good policy on a purely financial basis. So the notion of Oregon Saves is not only a matter of inclusion and accessibility. I can say to my most conservative friends in the Oregon legislature, look, if your only concern is small government, shouldn't it be a good idea to help people save more of their own money? Same kind of thing as an investor. Shouldn't it be a good idea for us to say, as we have in the Oregon Investment Council, an explicit statement in our investment beliefs that we think diversity, equity, and inclusion is a material factor in how we make our investment decisions. We got to make sure that the places where we invest are reflective of the population, not only, as I said before, because it's the right thing to do, and it is, but because we don't want to miss opportunities as investors. So I think the answer probably depends a lot on where we are and the vantage point that we bring, but we've all got a role. We've all got a responsibility to speak and act and to help each other in those other roles that we all have.
Carrie.
Well, I think that there certainly is a big public sector role here. I don't know that we're going to get much traction on that at the federal level currently, but certainly there's a lot going on at the state and the local level. That I've talked about the federal minimum wage. The minimum wage in a lot of states and municipalities is much higher, and a lot of insured benefits that aren't insured at the federal level. So there is kind of public sector involvement in this. But if you think about it historically in the United States, more than most developed economies, I think, we have looked to the private sector to ensure financial wellness for our citizens. And that was for a whole host of reasons, and for a whole host of reasons that, again, we don't have time to talk about here, that atrophied a bit and that diminished a bit. I think that and more than a bit actually, but I think that we might be at a point where we're pivoting back toward more corporate and private sector involvement in ensuring financial wellness. That, again, this idea that if we can accumulate the evidence showing that not only is this bad for individuals, it's bad for society, but also bad for your bottom line, then it makes an argument or a case for the private sector to move in.
All right, I'm going to go in a totally different direction. I may have slightly lost track of the question, but I think that's okay.
Well, let me help you out here because I think. No,
Don't you want to hear what I was going to say.
No. The reason I wanted to end with you is because, quite frankly, I have never been to Aspen before. I'm in love with it. It is beautiful. It is just as extravagant and wonderful as I expected it to be. But when we're talking about issues of race and moving in spaces, and as you and I can both attest to, the system, we've been raised to think, you can't play the race card, and we can't carry that backpack or have it weigh us down. We have to keep going. But the systemic weight of having to do that. Talk about that issue in terms of how to move in these spaces.
Yeah, you set me up perfectly. This is exactly where I was going to go. I think we can't ignore the issue of race, and I think when we talk about poverty, we get wrapped up in thinking that if we can just lift everybody up, that it lifts everybody up, and that's just not true. And so I think that we have to think about the disproportionate impact on people of color. And until we do that, I think we will not succeed at finding some longer term sustainable solutions to these problems. And just to be really concrete, I'll give two examples of places where I think there's a space for more research. A lot of folks now are talking about volatility in income and earnings, and I think that when you look in that space, there's a lot of questions around racial bias, and even just, I've done some research recently in looking at tipping versus service charges, and do people of color that work for tips make less than their white counterparts? There's also a lot of interesting questions when you look at other types of gig economy workers and volatility there and potential racial bias. So I think, to me, that's the question that we have to come back to, and thinking about it on a systemic level and not just on an individual level.
Perfect. Well, I think we do have some time for questions. So who has the microphone? Why don't we start here? And then we'll just sort of popcorn back and forth. Tell us who you are and...
Buenos días, mi nombre es Lourdes Rodriguez, and the backpack that you're talking about is called allostatic load.
Yes.
Look it up, and it weighs differently based on the gradient of your skin color. But that's not the question. The question, thank you
though, yes.
So the question is about the worth of the wage, right? I'm sure we all appreciate that the bathrooms that we used this morning and that we will be using throughout the day are clean. I'm sure none of us would want to have to clean it during the day. And the worth of the people, or the worth of the time of the people that clean those bathrooms is very different than the worth of the time of everybody sitting here. So I would love to hear your thoughts about wages and the worth that we put on people's time.
Great question.
Yeah. Thank you.
Do we want to just get a few questions, or do you want to? Does someone want to respond to that?
Maybe get some questions.
Okay. All right. Let's start here. Howard.
Thank you all. This was a fantastic panel. I'm Howard Frumkin from the Wellcome Trust. We didn't talk much about living wage, but I'm assuming that all of us think that it's a good idea. But if it's a good idea, why isn't a guaranteed basic income an even better idea?
One more back here. Yes, red sweater.
Good morning. Thank you.
Who are you?
I'm Lisa Fitzpatrick. I'm one of the Health Innovator Fellows, founder of Grapevine Health. I grow weary of us talking about research on these topics, particularly around poverty, social issues. We have a lot of data on this already. Why aren't we moving toward interventions and pathways out of poverty instead of spending our money on research?
And here, you're right here. And then we'll do another. We'll respond to these and do another round.
I'm Denise Diani, and I'm here for PBS, and we're doing research on the future of work and the impact on the American worker. One of the things that I'm curious about, and you mentioned the gig economy, is under the Obama administration, there was a tightening of regulations about who could be construed as an employee and who was a freelancer or contract worker, which of course is significant in terms of benefits, and including health care and other kinds of benefits. Also a lack of precariousness. If you're an employee, there's more predictability. Under the current administration, those rules are going, regulations are going in the opposite direction. They're being loosened. So increasingly, and the platform industries, which are a huge employer right now, are really working hard to fight employee efforts and worker efforts to become employees and are succeeding. So I'm curious about that from an industry policy point of view. And to your point about who you're investing in, companies are pushing back to keep people, workers, not employees, and that's a system issue.
Let's do some top-of-mind responses to these questions, and then we'll try to get another round. Does anyone have any?
Boy, do you want to start? Well, one thought that I think touches on a couple of these points is that I think it's important for us to think even more broadly about how we measure the success of different types of policies. And I think that as a psychologist, I think we can think a lot about how do people feel included in their communities? How do people feel belonging? Like, what are the other metrics that I would bet also correlate to different types of health outcomes? And so I think that that's a space where there's a lot of room to explore more deeply, is just how do we measure mobility? What are the right measures of understanding when we're doing some of these things well and when we're creating healthier communities? So that's just one in response to a couple questions that were brought up.
Maybe I can pick up on that and expand on it. I think you're right. For me, the thought that occurs as you're talking is that those measures need to be really long-term. So much in the investment world, so much in these policy worlds are so short-term. Did you do something today? Did you deliver the profit for the quarter? How many people have you enrolled, or what's their average balance in their retirement account today? So I want to support what you're saying and suggest that as we develop those metrics, we really need to resist the temptation that's probably in all of us biologically to think about the short term.
Does anyone want to tackle that guaranteed minimum wage piece?
I'm in favor. I'm with you on that.
Me too.
I don't think it is I don't think it's on the horizon in the near term. There's some research on and I have to disagree with you about we have enough research. I'm not sure we do, but there is some research on, and a lot of it is the devil is in the details on these guaranteed wages, and so I think it's kind of a complicated question. Is it something to strive for? Sure. I wanted to address this issue of the gig economy. One thing that's interesting is how big is the gig economy? And I think what you pointed out is exactly the right point, that you read the gig economy isn't that big, except if you change who's the definition of who's an employee and who's a contractor, then the gig economy includes all the Amazon employees. It includes all these platform employers. So it makes a much bigger difference. Honestly, in the Obama years, I always thought the gig economy is like 5% of the workforce. It wasn't what really was most people's lives. But I think, as you point out, it's getting to be bigger. And there you really don't have you don't have labor law, you just don't have the protections that you have other places. So that's a troubling, I think, development, no question.
May be able to get a couple more here, and then we'll come back over on this side.
Richard Wittenberg from Adolescent Children Together for Health. My question I'd like to direct to the state treasurer. You must be familiar with, given you're the state treasurer, with the power of the state treasurer. So you have money, and many states have used linked deposit programs for social good. Yeah. And I was wondering if you, not using the taxpayers' money, because a lot of people misunderstand. We're not talking about using the taxpayers' money. We're talking about using the power of taxpayers' money for social good. I was wondering if you had any thoughts on that.
You're talking about the individual development accounts and those sorts of things?
No, I'm talking about, let's say you're going to, you obviously, as a state treasurer, you have cash management system.
Yes.
And you have times when you need to invest the money.
Yes.
So let's use a bank, for instance. You say, okay, we'll put X amount of dollars in your bank.
Yeah.
You lower it out at a lower interest for social good, whether it's housing, small business loans, farm loans. And many states have had success doing
Yes, yes, we try to do that and keep those dollars local. The challenge, and this is the tension for every state treasurer, is what the source of those dollars. The bulk of the dollars that are available for that purpose are in short-term funds from state agencies and local governments who choose to participate. So we have to keep their liquidity and generate returns for them to do the things that they want to do with it. On the pension fund, we have to be generating benefits for our beneficiaries. So there's always the tension between the things we would like to do, but they have to come on top of the things that we're obligated to do. So we're looking for those opportunities, and we do collaborate with a bunch of other treasuries to keep pushing for those opportunities. Yeah.
I think our time may be drawing to a close. How much time do we have left? Just 1 minute.
Oh,
So
we'll stick around.
that was what I was going to suggest. The panelists will remain here. I just want to take this personal opportunity to thank the Aspen Institute for inviting me to the event, but also I just have been absolutely blessed and grateful to be able to interact with and meet people like our panel here today. So let's give them a round of applause for being here.